All right, I think we've reached critical mass, so feel free to pop your cameras on if you're comfortable with that. My name is Emily Castillo. I am the Director of Programs here at Insure the Uninsured Project. Thank you all for joining us for the North Central Regional Work Group. It's a pleasure to see some familiar names and some new ones. So we're grateful that you're here. Just a few logistical reminders. Make sure you're muted when you're not speaking. We should all be pros at Zoom at this stage in this never-ending pandemic. Probably all of that, but like I said, if you're welcome to come on camera. We'd love to see your faces. We've got quite a few ITUP staff who have turned on their cameras as well, but no pressure there. I'm going to go ahead and pass it over to Katie Hydorn then to get us started. She's the Executive Director of ITUP. Thanks again.
Hi, everyone. Good morning. It's so wonderful to see you all here. As Emily said, I'm the Executive Director of ITUP. And it's great to see familiar names and new names. Yeah, welcome at 9:30 on a Thursday morning. Hope you all are hanging in there. I feel like ever since we sort of gotten back to normal a little bit, but we're still on Zoom, it feels like we're in this perpetual sprint. So I feel that way too, but I appreciate you all making the time to be here. Very happy to see you all today. Really appreciate Emily going through our housekeeping. I think we're going to start off with introductions. I know it's kind of popular now to have everybody put their names in the chat, but since we're a work group and want to have it feel like we're sort of in person, I'd love to just go around and actually have people turn on their cameras and introduce themselves and talk a little bit about what they do before we jump in to some policy updates, some general updates, and then some Cali and conversation. I know Emily's already introduced herself, but I'll let the other ITUP members on this call. Most of them are just listening, but I'm going to let our team member, Olivia, who's taking notes today, introduce herself first, and then I'll go around my screen. Olivia, you want to start us off?
Hi, everyone. Happy to be here today. I am a graduate student at UC Berkeley, Golden School of Public Policy, and I am ITUP's intern for the summer. Really happy to be here, and I'll be taking notes today.
Thanks, Olivia. Shirley.
Hello, everyone. Pleasure to be here. My name is Shirley Lamb. I'm a second year MPH student with the University of San Francisco, but here in Sacramento, focusing on health policy leadership. I am also one of ITUP's interns, so I'll be here with content support. So.
Thanks, Shirley. Let's go with Mary.
Good morning, everyone. My name is Mary Nguyen, and I'm ITUP's health policy analyst. So nice to see all of you.
Thanks, Mary. Sandra?
Hi, everyone. I'm Sandra Hernandez. I'm the Senior Communications Coordinator here at ITUP, and I manage external communications, including social media and website. Thank you for being here.
Thanks, Sandra. Marissa?
Hi, everyone. Good to see you all. I'm Marissa Kranak, ITUP's Director of Health Policy Research.
And did I miss anybody from the ITUP team? Beth?
Hi, I'm Beth Abel. I'm the Director of Administration at ITUP, and I'm happy to be here.
Thanks, Beth. All right, let's go around here. I'm going to start with Rob. Please go ahead.
Hi, good morning, everyone. Rob Oldham. I'm the Director of Health and Human Services for Placer County, and I'm also serving as Health Officer and Chief Psychiatrist, so a psychiatrist by training. Good to see everyone.
Oh my goodness, only a couple roles in the county next door. Wonderful.
Yeah,
thanks
keeps
for being
me out
here.
of trouble.
Very true, right? Very true. If you're super busy, can't get into trouble, or at least other non-good types of trouble. Let's go with Terry.
Hi, Terry Stratton. I'm the CEO of the El Dorado Community Health Centers. Thank you.
Thanks for being here, Terry. Good to see you. Rebecca.
Good afternoon, everybody, or morning. I'm Rebecca Boyd Anderson. I am the Director of Population Health at Partnership Health Plan.
Thanks, Rebecca. Great to see you. Philip.
Hi, good morning. Philip Hernandez. I'm with Sutter Yuba County Behavioral Health, and I'm the Program Manager for Substance Use Disorder and Forensic Services.
Wonderful. Thanks for being here. Catherine.
Good morning, everyone. Catherine Power, Community Relations and Policy Manager at Partnership Health Plan.
Thanks for being here. Steve.
Hi, good morning, everyone. I'm Steve Soto, Managing Principal for Health Management Associates out of our Sacramento office, a national healthcare consulting firm. We help a variety of clients with Medi-Cal and CalAIM implementation and track how it's going around the state. And I'm very happy to be here today.
Thanks for being here, Steve.
Sure.
All right, Kathleen.
Good morning, everybody. I'm Kathleen. I'm a consultant with Aurora Health Group.
Nice to meet you. Thanks for being here. Ariana.
Hi, good morning, everyone. Happy Thursday. My name is Ariana Phillips. I am a regional program manager with HealthNet, depending on the county, or California Health and Wellness. And I am helping with the CalAIM implementation, and I covered 19 counties. So thank you for having us.
Oh my goodness. Nice to see you. Good luck with all of that. And I think you're wearing both a HealthNet and a California Health and Wellness hat in this meeting today. So yes. Good luck with that also. Joyle, go ahead.
Hi, good morning. Joel Zong with Sacramento Covered. I'm the Senior Vice President of Operations here. We are a CalAIM, both under the ECM and CS provider here in Sacramento, as well as surrounding county with Kaiser, through Kaiser.
Thanks, Joel. Good to see you. Sunny.
Good morning. My name is Sunny Samra. I'm with Jakarta Movement. I just started like 3 weeks ago. It's a nonprofit organization that helps the underprivileged, marginalized, minority communities. And I'm going to be working as a CHW out of Sutter County. Thank you for having me.
Fantastic. Wow, wonderful work. Thank you so much for being here.
Thank you.
Let's see, Tessa.
Hi, I'm Tessa Hammer. I'm a staff attorney with Legal Services of Northern California and the Health Consumer Alliance, and I'm located in Solano County.
Wonderful. Thanks so much for being here, Tessa. James.
Hi, good morning, everyone. My name is James Wilson. I'm a regional program manager for Anthem Blue Cross, covering the northern rural region, and I'm based out of Plymouth County. Happy to be here.
Awesome. We were on the phone with some folks in Plymouth yesterday talking about health and broadband. So I'll be reaching out to you.
Cool, definitely.
Nice to see you, James. Thanks so much for being here. Jared.
Hi there, good morning. Jared Martin with Anthem Blue Cross, County Accounts Management. I'm on the same team as James, actually. And I was just on a call talking about broadband internally, so I'd appreciate the opportunity to connect further.
Fabulous. And we also have a broadband poll for you all today. So you guys expect James and Jared to respond to that poll. Let's see, Jennifer.
Good morning, everyone. My name is Jenna Balahai. I'm the Executive Director of Yolo County Children's Alliance. We are the Child Abuse Prevention Council and Community Health Initiative of Yolo County. And we're just starting on our journey with CalAIM. So I'm really excited to listen in and taking all the information that I can today. However, my apologies. I will be leaving a little early, Katie, for another CalAIM meeting at 10:30.
That's okay. I'm glad that you are taking time it takes a lot of time, so no problem at all. You got to do the work too. We just appreciate you being here and wonderful to see you.
Thank you.
And Liza.
Hi, I'm Liza Thanchinaw. My pronouns are she, they. I am the Regional Counsel for Health at Legal Services of Northern California. We provide free legal services to health consumers in 32 counties.
Wonderful. Thank you so much for being here. All right, I think we got everyone, and really appreciate you all taking the time to do real introductions. It's just so helpful to know who we have on the call and what roles you are all playing. And I really appreciate this. It feels very representative of all of the entities, from community health workers to plans to community-based organizations to consultants who are working on CalAIM. There's just a lot going on, and it takes a lot of us to get this moving. So I know we have a welcome poll. So I'm going to let Emily launch that, and bear with us. This is we just started using polls, and it's really helpful for us to collect a little bit of extra information from you all. So please go ahead, and when you see it pop up, just take 30 seconds to fill it out for us, please. All right. So, and then I think, Emily, we also have our broadband poll, right?
Yes, but we only have one person who responded to the first poll, so maybe give it a couple more minutes.
All right.
So there's 3 questions, so it might take a teeny bit longer than 30 seconds. But yes, as Katie said, we appreciate you filling in. It's always good to capture data from our work groups.
This is how we do group activities these days.
For those of you who have attended in our in-person work groups, no more paper evaluation. So this is kind of our paper evaluation.
Perfect. I'll give it just another 10 seconds and then we'll move on. Don't want to distract anyone with chatter. Perfect. Thank you all. Really appreciate it. All right, Emily, do you mind launching? So just a bit of what we're doing. I'll jump into other updates, but a bit of a call to action. ITUP got way into our statewide and local broadband conversations and closing the digital divide in our work groups. And some of you may have attended, right? We took a pause from talking about CalAIM and care coordination, which we've been working on for years, even prior to my coming to ITUP a few years ago. And we took a pause to, of course, talk to you all about the COVID pandemic response the last couple of years, and now we're back to CalAIM. But something that really came up, other than making sure that we had coverage and conversations about testing and vaccine rollout, was the transformative nature of telehealth. And I'm sure all of you are working in that, and we've been working in it too. I've been serving on the Department of Healthcare Services Telehealth Advisory Committee, talking about telehealth going forward, and very excited that the state's going to keep a lot of the flexibilities in telehealth going forward post when the public health emergency ends. So that's really exciting. But when we talked about telehealth in both rural and urban communities and suburban communities, everyone said telehealth's really transformative, very excited about it, but we don't necessarily have connectivity, and we don't have the appropriate devices, and we don't have digital literacy. And so we essentially invited ourselves to broadband conversations when some folks from one of our work groups said, oh, there's a broadband for all executive order. And so for the past 18 months, we've really been diving into broadband and the need for connectivity and really working to bring the health voice to that conversation, because the broadband community thinks that healthcare, hospitals, and clinics are involved, but many of you, we've discovered, have not been involved. And mostly because I think we weren't paying for telehealth in many ways, and we've been very focused on electronic medical records and things like that. So it's really exciting for us to see that shift. And so any of you who are interested in broadband, digital navigation, which I think is a great connection with community health workers, just wanted to give you an opportunity to answer this poll, because this is something that we're working on locally, state, and federally. We're not going to talk about it anymore at this work group, but would love to follow up with some of you afterwards. So if you'd like to follow up with us, we have the data from this poll, but also feel free to direct message me or Emily in the chat, and we'll capture that. Thank you all. All right. So other updates, I think, as many of you know, ITUP, in addition to our statewide conference and our local working groups and our fact sheets, we do a lot of, we also follow the state budget and bills. We have some really great resources on that. We just published our blog post for the May revision, which has been sent down to the governor. So the budget is now with the governor, and we will see what he does with a nearly $300 billion budget. Just for reference, this is a wild amount of money that the state has to spend. Typically, they have about $2 billion every year to spend on legislative priorities and administration priorities. This year, they have $75 billion. It's just a lot of money. So that's why we actually see a lot of really amazing things and initiatives coming out of the budget. I think obviously a big piece of that is really almost fulfilling ITUP's mission, right? Ensuring the uninsured. The state is poised to enact the final Medi-Cal expansion to undocumented individuals. So we're really excited about that. That should go into effect January 1, 2024. So that's just really incredible. We have some good resources about who the remaining uninsured are in California. But this policy change will get us to at least the place where most people are eligible to have some kind of health insurance card, whether it's through Medi-Cal or Cover California. So you'll start seeing ITUP pivoting from just talking about coverage and getting people coverage to making sure that that health insurance card is actually meaningful. Hence our work on telehealth and broadband, and in some other, and on CalAIM, really trying to make sure the health system's working for people now that we're poised to have coverage opportunities for almost everyone. So really, really excited about that. Something else, particularly because we do have Sunny on, who is a community health worker. The state is poised to approve funding for 25,000 community health workers. Really incredible, I think, and the Department of Healthcare Services has approved community health workers as a provider category. Huge. And for many of you who are working in this area, it's, yeah, wow, right? Sunny, if you need more information on that, let us know. We're happy to connect with you offline. And I know Shirley just put in the chat, we do have a community health workers fact sheet with some policy considerations and sort of examples of who can be community health workers. Really, and also even stretching to think of those community health workers as even digital navigators in this new space. So that I think is huge. There's real money for that class of workers, which I think will really help people get into the community and continue a lot of the good work that we saw happening during COVID, and really targeting the hardest to reach and most vulnerable populations. Geneva, I think you're right. That's wonderful news for community-based organizations like yours. So I'd say those are probably the two biggest pieces of the budget that we're following. There's a whole lot more in it, including funding for CalAIM and PATH funds that we'll talk about. But those are really, really, I think, the big ones. Shifting to what's on our plate, and some of which is also in the budget. One of the biggest things is the unwinding of the public health emergency. We're really focusing on that, and also Medi-Cal expansions. And so I wanted to, those are kind of the first couple questions on our agenda today. How are you all preparing for the unwinding of the public health emergency and coverage expansions? Would love, and Shirley, thank you for dropping that in. The Department of Healthcare Services actually is a little out ahead of this, which I think a compliment to them. I don't know that government's always out ahead of this, but they have an unwinding toolkit that Shirley dropped into the chat that I hope you all have seen. If you have any questions about it, please feel free to reach out to us. This is going to be a really big deal. And I think a lot of that, as I said, a lot of advocacy organizations in Sacramento are really trying to keep a lot of the good things that came out of the pandemic and a lot of the flexibilities as we go forward. But we know that the ending of the public health emergency, particularly on enrollment, is going to be a really big impact. We're going to have to re-enroll 15 million people in Medi-Cal. Yeah, I know, I see Rob going, oh, yeah, that's going to be tough. For everyone from, Geneva would love your thoughts on this, from outreach and enrollment entities all the way to folks like Rob who are doing this work with enrollment systems. So, and then health plans, right, where you might see some churning in your members. I'd love to hear your thoughts on this. If you've looked at the toolkit, if you have plans in place. I know that we don't have a date from the feds yet on this, but certainly going to happen in the next 6 to 9 months, depending on how the economy shakes out. Does anyone want to jump in? Rob, I saw you shaking your head and your video's on, so I'm going to call on you.
Well, you mainly saw my pain of reminding me, right? But no, and I wasn't aware of the toolkit, so definitely I imagine folks in our human services division they're kind of on this. And part of my kind of groan is it's an opportunity, but we're doing a lot of, especially in human services, a lot of other things at the same time, and kind of starting to implement CalSAWs and all this stuff. And so and of course we all have workforce issues, but I mean one of the strategies, obviously, and I appreciate lots of community-based organizations, so partnering. The government can't do it all, but really that's what's helped us throughout the pandemic, is really those strong partnerships. So that's certainly one of the strategies, is to really making sure that we have local capacity to engagement into the communities, especially where with high rates of Medi-Cal beneficiaries. But I will certainly pass the toolkit along and make sure that our team has it here.
Perfect. Thanks so much. Terry, go ahead.
Ditto to what Rob just said, both as far as the challenges and CalAIM and all the plans are asking us for contract signatures, and there's just a lot on our plate right now, and a shortage of staff to do it. So thank you.
Yeah, thanks, Terry. Can you say a little bit more about an FQHC's role in this type of outreach?
Yeah, I think we have a significant role to play. And are you specifically referring to the workers, or are you specifically talking about the broadband?
Well, all of the above, but I was going to focus on the unwinding.
Well, yeah, I don't. To be honest with you, I'm not sure that we're unwinding yet.
No, we're not unwinding quite yet. We're prepping for the unwinding.
And we were not aware of that toolkit. So we're right now, I think our primary messages to our patients and community are still around vaccination and now rolling out the under 5 group. So we're not we're not focused on unwinding yet. We're still focused on vaccinating and testing. Testing is still a big deal right now, and getting resources out to our community to do that.
Yeah, I mean, Terry, actually, that's a really great comment. We'll certainly take some of this back to the department and tell them that they need to continue to push out their toolkit, and we will also, I think, continue to push out the toolkit. Because you all know, you all are right in the middle of this. And if you didn't know about the toolkit, then I think that's an issue for the state. So thank you. I'm going to go to Philip next.
Hi. So from the county service perspective, I mean, I haven't seen I don't know that we've seen this unwinding toolkit, but what I can say is that, through the pandemic, we learned quite a bit as far as providing services through telecare and telehealth. So I know that we're more in an integrated space as far as being able to use telecare and telehealth to continue to outreach to people that are seeking services. So I think that it's been a good thing. On the forensic side, one of the real benefits that we found is, the courts being able to provide Zoom for defendants that are out in residential treatment, or, they're just not able to get to court, but they have a device and they're able to connect. And so we're able to do in-person reviews in like drug court, behavioral health court, and the like. And so that is, I think that's going to maintain, because I know the judges have talked really positively about having that ability to check in with people. So I would like to review this, the unwinding toolkit, but I know that to some degree we're going to maintain some of those, some of those benefits as far as the electronics are concerned.
Yeah, absolutely. I think that so we're very interested in telehealth and making sure that we have good payment for it, because we can use it as a baseline and use it as tools, right? I think that that's what's so exciting about telehealth, is that instead of just saying, well, an audio only visit or a video visit's equivalent to an in-person visit, we can actually talk about it as being a tool in cases, in sort of what you're talking about, where it can actually be part of a system of care. I think that's really exciting. So thanks for that. Also, Philip, just for you, I'm sure you're tracking this, but peer support services, there's sort of 3 new provider categories: community health workers, doulas, and peer support. So I'm sure you're tracking this, but for folks who are not as familiar with the work that Philip does, this is something that's also really exciting and I think transformative for that community that I've been working on that bill for probably 15 years, Philip. So I'm excited. It's fine. I kid you not. We remember the old Department of Alcohol and Drug Programs?
Yes.
Definitely was in meetings with that a long, long time ago. So excited to see that.
Congratulations, because it is a huge asset to our system. So
yeah, absolutely.
It's great.
Thank you. All right, I'm going to go to Catherine first and then to Geneva.
I think actually Geneva had her hand up first, so I'll let her go. Yeah.
We'll go to Geneva and then Catherine. Perfect.
I put my hands up and down earlier. No, I wanted to basically echo what I don't know where she is. Terry was saying earlier about This kind of sneaking up on us as community-based organization. Our entire focus has been vaccination outreach, as well as COVID testing and other community supports throughout this pandemic. But hearing about, just trying to enroll thousands of people into Medi-Cal, this is my cue to definitely reach out to our county. We do have a really great partnership with our county where my organization is in-house at the benefit center, where we're able to do walk-in appointments and enroll people, especially our immigrant communities and hard to reach languages, where we're able to enroll them in the county benefit centers, as well as in different community, different specific areas throughout the community. But one thing that I would like to share as a CBO, I feel like a lot of the time there's a lot expected of community-based organizations, but there's not a funding to back it up. So I was I'm very excited to hear about the Community Workers Initiative governor's budget. We need to be paid to do this work. And any county that's listening right now, you need to incorporate your on-the-ground community-based organizations that are already connected with these communities to help with your enrollment process.
Yeah, Jenna, thank you for that sort of call to action. 100% agree with you on incorporating community-based organizations. You referenced the Medi-Cal Navigator program, so I just put a link into that. This is the program that is funding folks to do outreach and enrollment. As we all know, that's really going to be critical to keeping people enrolled in Medi-Cal during this unwinding and all of that redetermination. So if you have questions, let us know. There's also a stakeholder group that's sort of sponsored by DHCS, but run by the California Coverage and Health Initiatives. They're actually meeting next week on June 22nd. So if anyone's interested in that meeting and it's not on your radar, let us know and we'll make sure we get you connected to the group. They're doing sort of a deep dive on this Medi-Cal Navigator project. They're rolling out some grants that I'm sure Geneva's connected to, but there are opportunities for others in additional rounds. So if you have community-based organizations who want this type of funding or want to join this group, let us know. Geneva?
Katie, is it possible to send a wrap-up email with all of these various links at the end of the meeting?
Yep, I see Emily and Olivia and Shirley nodding. We are triple capturing it.
Thank you.
Thank you. Yeah, we will. Perfect. All right, Catherine, your turn.
Yeah, just really quickly wanted to chime in from the health plan perspective. And again, our Director of Population Health, Rebecca Boyd-Anderson's on this call. So Rebecca, please feel free to jump into what Partnership is doing right now, aside from our usual enrollment projections and trying to understand just kind of the volume of new members we may see or change in members we may see. We're also sharing the DHCS toolkit, which I think a few folks here didn't know about, so that makes us feel very validated that we're still sharing that with some of our community partners. In addition to that, we're also sharing the grant materials as well. We've actually written at least one, and I think we're working on a second letter of support for some of our CBOs to apply for that enrollment grant that you just mentioned, Katie. And then proactively, we are starting our member services team and some of our management team are starting to meet with each county to understand what their outreach and enrollment activities are going to be and what their messaging is and how Partnership can really kind of share that messaging and prepare our member services staff for when members call and they have questions. We're just trying to be aligned in each county with that messaging and really share resources and information with our members who may have questions. So that's what we're trying to do now. But to echo other comments from others, certainly we're all kind of pivoting from COVID. So I know we're all thinking about this in advance, but we haven't had too many work groups on it. So hopefully we'll continue as we march towards October.
Thank you. Yeah, absolutely. Anyone else, maybe from the health plan perspective, I don't know, Rebecca or Jared, James, others. Rebecca, you want to go ahead?
Sure. Catherine has most of Partnership's work well detailed. We do have a staff member on our team who is aligned with the DHCS Ambassador Program. We are adding questionnaires to every single outreach campaign we do, where we're reminding people about the importance of updating their enrollment information. And as Catherine said, we're seeking multiple means of pushing that information out to members.
Thank you. Jared or James, one of you from the Anthem perspective? James?
Sure, yeah, I can go. So we have been, with the county account management team, has been reaching out to all of our county social services as well, in anticipation of, like, there's a lot of different ways that we may receive some address changes from members. And if the permission to, or the flexibility of not having to ask permission of the customer to share these address changes is lifted, then we're anticipating being able to hand them over. And so we are having conversations right now about the best way that we might be able to deliver those, so that they can do outreach to these members and make sure that they're re-enrolled.
Thank you. And then Ariana, anything you wanted to add from the HealthNet Cal Health and Wellness perspective?
Yes. Oops. Sorry, there I am. Okay, hi. I was reading through all the great materials and the links as well. So again, thank you for providing those. And I also want to say too, we have another internal staff person who is more knowledgeable about this category. So I apologize for not having them on this work group today, but moving forward, I will make sure to include them. But just as Anthem and Partnership mentioned, we also are reaching out to our members as well. I'm letting them know through our member newsletters that's sent out just about re-enrollment. And then I was looking up information too, like in the beginning, we were talking about, telehealth services, and we're working with local providers and our different rural counties to have an Android device or something within the different public health or behavioral health departments, just so members can utilize those devices to help with, any and everything related to their health and wellness. So if that's looking into resources within their community, enrollment services, et cetera. So we're constantly trying to, improve access to resources and information for our members as much as possible, but more information to come. So thank you so much.
Thank you, Ariana. And let's see, Joyle and Janine, I'm going to put you both on the spot. Joyle from a similar perspective as Geneva, community-based organization doing outreach and enrollment. And Janine, I know you jumped in a little late, but we're talking about unwinding your PHE. And since you're with the county, I was hoping you could maybe jump in a little bit on that too. Joyle, you want to, Janine, you unmuted first, so why don't you go ahead?
Sure. Well, I'll just say that I know that it's our sister department. I'm with the Department of Health Services, but our sister department, Department of Human Assistance, is working with the managed care plans to plan for that and arrange for sharing of contact information. And also this was raised by our community advocates and partners to see if there's a way that HMIS data potentially could be leveraged if they have more recent contact information for some individuals to support sharing that. So I think those are some of the ideas that our county will be exploring.
Great, thank you. Really appreciate it. All right, Joyle, anything to add?
I don't. I'm trying to ping one of our directors to come in because I was like, hey, this is very important. It'd be good for you to jump on. So I don't, but thank you.
That's okay. Thank you. Well, I'm glad that even you're pinging one of your folks. Definitely make sure you share the toolkit with them. It's a really great feedback. Anyone else want to chat about the public health emergency unwinding? Okay, I'd love to jump a little bit to the coverage expansions because we did a culture of coverage policy forum about a month ago. And when we talked to folks, all they wanted to talk about was the public health emergency unwinding, which I of course completely understand. But that also made us realize that a lot of, I think, our typical partners on coverage expansions are focused on the unwinding and less on the actual coverage expansion. And I think, just a reminder, the coverage expansions, the over 50 coverage expansion for Medi-Cal just went into effect at the beginning of May. So we're right in the middle of that. So an older adult coverage expansion. And then where the coverage expansion that should be signed by the governor in the next few weeks is to expand Medi-Cal eligibility to those aged 26 to 50, which is the largest group of that group of undocumented immigrants who are in that who are waiting for coverage to be extended to them. So I think those are typically some of the hardest to reach people, really where we do need the support of community-based organizations, where folks in the county are, going to need to maybe reach out and do things a little bit differently. So I was just curious if anyone was paying attention to that or had any experience. I know some of our partners at CBOs in Orange County on our work group last week talked a little bit about this. It's okay if you're not focused on it, but I was just curious. Anyone doing that work? Jennifer, are you all doing any of that work? No? See, this is also the absence of conversation on this also is really important. Go ahead, Jennifer.
It's just, I think what's happened for us over the past 3 years is just COVID. And we haven't come out of that space yet. As the Child Abuse Prevention Council, we're being asked to pivot to the under 5 population now, which is giving me a little bit of anxiety, especially with some of the population that we work with in Yolo County and vaccine hesitancy. So unfortunately, that's the space that we're in right now. But, and that's one of the reasons why I wanted to be in this meeting today, to really start to pivot and think about all the things to come.
Perfect. Thank you. Yeah, that's a really good point. We're still in it. So yeah, important reminder.
Cases are going up in our county, surrounding county, although I feel like some people are having amnesia where we're pretending that it doesn't exist, but it still exists.
Yes, as a parent of 3 children, 5 and under, I am well aware that it still exists. Daycare closures are still happening. I think even my youngest, we had overlapping meetings last week, and so she helped me facilitate one of these work groups for about half an hour last week. Yeah, it was exciting. So yeah, we're right there. And one more tranche of vaccines to come out, hopefully in the next few weeks. So there's good news yesterday on that. Philip.
So Katie, I'll just comment that I'm not aware of the coverage expansion, and I'm hoping that there's people in our agency that are, but I also know that we've had a lot of turnover over the last year or two. So
yeah,
I think that it would be important to get a little more information on that. So thank you.
Yeah, absolutely. Philip, I think a really good resource for you all is the policy forum recording that Shirley just dropped into the chat right there. And then actually all the way up at the top again, our ITUP blog on the budget has information about the expansions as well. And I think we could probably find an expansion, the older adults expansion page for you as well. That's on the DHCS website. Yeah, happy to do that. All right, anything else on the coverage expansions? Okay, perfect. Then I would love to shift to CalAIM. Emily, do we have a poll that we're supposed to launch right now, or are we good? Okay. We have lots of polls, lots of audience participation today. So our, the main part of our agenda is really focused on CalAIM, and we wanted to talk, I think, specifically about community supports and sort of how health plans and community-based organizations are working together or not working together, as it may be, to really try and roll this out. So we have a few questions that are focused on focused on that. So to start us off, I'd love to just some basic questions. What are you doing to prepare for CalAIM and rolling that out in each of your counties? Does anyone want to talk about it? I'm happy to start with good stories if there are good stories about working together. And I can start calling on folks who I know have talked with us in the past about that. But if anyone would like to volunteer, that would be wonderful.
All right, I'll jump in.
All right, go for it, Philip. I also appreciate that you're here because I think you're going to talk about an aspect of CalAIM, particularly with the reentry population, that we don't talk a lot about. So would love to hear from you and your thoughts.
Good. Okay. Well, and I'll just say from our county's perspective, personally, I think that we're a little bit behind the 8 ball as far as preparing. I think just this month we started having weekly CalAIM implementation meetings. I'm not sure what's happening on as far as the fiscal side and the billing and that part there. But I know programmatically, we've just started this month, and so I think that is partly bandwidth as far as staffing and so much other things going on with QI and a lot of the administrators. So, but we're working towards at least figuring out what we're going to need. And, some of the big changes with documentation and moving away from a treatment plan and into a problem list, and then being able to integrate the changes into the EHR. So there's quite a few steps. And right now, I think we're just having discussions about, what it's going to actually look like. And, my comment recently was like, this takes effect July 1st, everybody. So, and, technically it went into effect January 1st. So we've had 6 months to do this, but, in county land, it's just, it's really difficult to get, to keep up. I mean, quite frankly. So, yeah, I think we're a little bit behind on this and, trying to catch up. And I think we're just going to take it step by step and do the best we can to get to where we need to be.
Yeah, thanks so much, Philip. Others who are working through CalAIM planning, doing outreach maybe to community-based organizations or any community-based organizations that have received outreach or maybe working with your county or local health plans. Rob, go ahead.
Yeah, and I think in Placer, we're maybe a little further along in some ways because we were a whole person care county, so that actually has been really helpful. And we have already some community-based organizations that have contracts in place with the plans. That it's been still a lot of work left to do, especially looking at kind of the next target populations, but certainly kind of the initial target populations we have. Made some progress and have some contracts in place already, both the county, but also several of our community-based organizations working with our managed care plans.
Great. Yeah, that is wonderful. And maybe something to think about. We can do a follow-up question on this, but I'd be really interested for you to think about how you're going beyond whole person care to reach out to other providers, or maybe that's not the direction you all are going. I think that's something we're hearing and maybe a big concern. So think about it. Let's see. I see Geneva and Joel's videos on. So Geneva, you want to talk a little bit about it? I want to make sure we get to you before you have to jump off to your CalAIM planning meeting.
I feel like Joel is ahead of us on this one. So Yolo County is actually convening providers today at 10:30 to speak with partnership about CalAIM implementation throughout the county. Normally, we rely on the county to lead and coordinate the TA, technical assistance, and onboarding for major things like this. However, the county is more focused on connecting us with partnership and having partnership take that lead for our organizations. My organization in particular, we're already doing the work. We're already in the community. We have an intensive homeless assistance program, as well as housing program, family resource center. So we're looking more towards family support, community support, and we're trying to get the information right now. It is very overwhelming, just to be completely transparent. It feels very overwhelming. It feels like this giant thing that community-based organizations have to look into, but we're excited about starting the process.
Great. Well, I'm really excited to follow up with you after your conversation today to see how you're going to sort of take what you're doing today and actually fit it into our less flexible DHCS structure. I think that's also been something that we've heard plans say to us, and also community-based organizations say that even though community-based organizations have been doing this work for, in some cases, decades, it looks just slightly different. And we all know how, DHCS and CMS, they just don't have a lot of room. So I'm really curious how you may have to adapt what you do to fit that box. And I know that's really hard.
And I wonder if there are opportunities to provide feedback where DHCS can also adapt to what community organizations have been doing for years. I'm just excited that there's an avenue for long-term sustainability for community-based organizations have been doing this work for many, many, many years.
Yeah, keep your eye on the prize. That's what I'm excited about. But we know that it's not that simple, right? You have to change a lot of what you do. So yeah, don't be shy. If I think we're certainly happy to have an offline conversation and make sure you're connected into the department if you have that kind of feedback, because I think that that's really important for them to hear and sort of be able to troubleshoot more at the beginning rather than further down the line. But yeah, would love your thoughts after the conversation today. So we'll follow up. Thank you.
I'm happy to provide my thoughts.
Happy. I know you're not shy, so
I'm not shy to my advocate.
We're happy to amplify because we know you're not the only one. So appreciate you lifting up. Happy to lift that up. Joyle, you want to go ahead?
Sure. So I think similar to Placer, because we were heavily involved, Sacramento Covered specifically were heavily involved in the whole person care, as well as we were also a provider under the Health Homes program as well. So I think just from our perspective, it was an easier, I guess, transition into CalAIM come, in January 1st. But as we all know, there's still a lot to be done on that front. So I feel, I think as Geneva said, we're further along. And so I think, we have some thoughts and certainly very strong opinions around, what we would love to see differently, what's challenging us on the ground with our community health workers. And then as far as just the population of focus that is upcoming, I know that members on my team are having conversations with the county, and Ginny may be able to speak more about it. I'm here. I know enough to be dangerous about what's happening. And so I can do my best to speak on it. But as I mentioned earlier, we are a CalAIM ECM and CS provider. We started out in January 1st, with some grandfathered clients from our pathways and health homes as well. I think like anything, it hasn't necessarily been smooth. We've been able to provide services, with existing or I guess former grandfathered clients as well as new clients. I don't know. I mean, I'm not sure where to start, and I don't want to say too much as well. So,
yeah, I think we'll have an opportunity to come back to you and talk about maybe how if you were in Geneva's shoes, what questions would you be asking of the health plan or the county or the department to, sort of shift and pivot and change your operations just a little bit to make sure that you can get all of that funding. I think about that. I'd love to come back and hear from that. Sure. Since you mentioned, is Janine, you're still with us. Would you like to jump in on this? I know you all are doing a ton of work, so.
Hi. Yeah, sure. I think similar to, is that Rob from Placer, we have made progress with the initial populations going live for ECM and the community supports. Many of our plans have offered many of the community supports already, and we have a monthly roundtable with our community partners and providers to share updates from all of our managed care plans. So different from our neighboring counties, as a GMC county, we're working with 5 managed care plans. And it's very helpful to have that forum to share updates and also to hear how implementation is going on the ground. And of course, we're building the plane as we fly it. So there's a lot of I think, challenges to troubleshoot. And just to circle back to something that someone raised, something to think about around getting the full picture of the needs and gaps across the county is something that we've flagged as is important. And again, given that managed care plans are leading the implementation, I think they have that picture for their membership, but that's an area that we recognize as the county is important to understand across the ECM populations of focus and the various community supports, what capacity exists across the county, where are the gaps, and what role might we play to help build capacity. So that's something we're looking to path funding as the state releases more guidance. Hopefully that will be able to help support doing a more robust assessment and understanding what role we can play to help ensure that we're leveraging all available providers, that they're aware of this opportunity and that they're sufficiently supported to take advantage of it.
Yeah, I think that is the key. Thank you, Janine. Really appreciate it. Also, this is our third work group of 10, and in every single work group, we have heard we're building the plane as we're flying it. So that's another takeaway for all that I think the feeling in the community, you're not alone, that's going on. I want to invite maybe a couple of the health plans, or Steve, I know HMA is doing a lot to help behind the scenes to help the plans to prepare for this, if anyone wants to jump in. Steve, you want to go ahead?
Real quick, we do help health plans evaluate everything that's available and their responsibilities under CalAIM for the outreach, the engagement with the counties, with CBOs, with the clinics, with the local providers for both ECM and community supports networks and services. But we also do that, within HMA, we have other folks focus on it from the other side of the telephone as well, which is helping the FQs, helping the counties make the most of the funding streams. And it's like everyone has said so far, the department is trying to accomplish a lot of things that many of you have been working on for years. That they have actually got this opportunity for funding. They've got the new waiver in place to allow for it. They have a very ambitious agenda on top of all the other things they're doing. And it is definitely true. They and you specifically are building the plane as we fly it. I think that the main thing that folks need to track is just the time frames, the time requirements, the deadlines for filing applications for this, pursue this funding stream here, because there's multiple funding channels and opportunities available, whether they're contracting opportunities between providers and the health plans, whether there's funding stream opportunity, and that goes with the counties too. The counties as a contract provider to the health plans for the ECM services and where possible community support services. My big advice would be, don't be shy, reach out to the health plans, make sure you're engaged with them. They've got a lot of stuff they're working on now, so make sure you're reaching out to them. And if you already got a good relationship with them, great. If you don't, take this opportunity to build one, because this is a time when everyone needs to be grabbing the wheel a little bit for themselves, whether you're the county, whether you're a CBO, and work with and reach out to the plans to make this work. These opportunities don't come that often. And for the challenges people have talked about, which is we're coming out of the pandemic, we hope, hopefully not going into a recession, whole different conversation. But there are opportunities here. So the plans have a lot on their plates right now because the department's throwing a lot to them. So don't be shy. Reach out to the plans, can work within make sure you work within your county as how your county wants this to work. But be, above all things, engage and be aware of the timeframes and the requirements and take advantage of the opportunities that are here right now.
Yeah, thank you, Steve. Really appreciate that. I think that's great advice for some of the community-based organizations. I know some of you are already doing a lot of that work, and same thing goes for the health plans and counties, right? Engage, and we just know how hard that is with limited resources. Others, James or Jared from Anthem.
Well, I could say that the whole CalAIM initiative has made multiple health plans work a lot closer together. I can't tell you how many different meetings I've been on with Ariana, for example. All my counties that I manage are both Anthem and California Health and Wellness. And I mean, I think that both sides are really just trying to find those organizations that are already doing the services because they know their community's needs better than anyone. And so really just trying to reach out to the CBOs and the counties to see how we can fulfill all these needs.
Yeah, thank you. Rebecca or Catherine, anything else to add?
Sorry, coming off mute. This is Rebecca. No I think the thing about community supports, like there's enhanced case management, which is a member-focused benefit that has very strict enrollment criteria. And then there's community supports that are designed to avoid incurring costs, more expensive costs. And and I say that because so often when you say CalAIM implementation, it's really easy to get confused between the two different things. And so a lot of the whole person care is actually in alignment with enhanced case management, not in line with the services that are covered under community supports. I think the other thing about community supports is that community supports are there's a really short list of what various health plans are offering right now, and then they will expand those. And for those of you in 5 counties, boy, I pity. I'm so sorry, because you got to figure out which each different health plan is offering. That's hard. But I do think that that we're tipping our toes in some really innovative waters. And like you were saying, Steve, I think it's really important that you maintain a conversation with your health plan in your area and see how we can maybe move forward. And along those lines, right now, as Steve also said, health plans are so overwhelmed. It's like, I can't even think about that today. Call me again in 5 months. And that's not a brush off. That's I want to talk to you. I just can't today.
Yeah. Yep. Absolutely. Steve, did you have anything else to add?
No, I mean, it's a fact of life right now. The plans have a lot to do. They know how important this is. But I know people don't sometimes want to believe this. The plans only have so many staff that are actually focused on this. I mean, I can't imagine, frankly, what Jared and James are up against and the other plan people right now, because they have so many things they know they have to get to, stay on top of, people to engage with. Partnerships got people working on this, as we know. The other health plans do too. And the only way to make sure things keep moving is you be the one who reaches out. You be the one who makes the effort, says, look, what can we do to help? What do we need to do? Are there local venues that we need to be plugged into? What do you have coming up that can help us here? Either directly with the plans or with the counties, to make sure everyone's hearing the same thing and knows what those opportunities are and can take advantage of it.
Mm-hmm. Yeah, absolutely. Anyone else want to jump in on how you're sort of generally preparing for CalAIM? All right. I think our next question gets a little deeper in this. So we heard a lot. We're building the plane as we're flying it. There's a lot going on. There's more guidance that's continuously coming out. Is there anything else that you all need, from whatever hat you're wearing, whether you're a community-based organization, at a county, a consultant, or at a health plan, or at a clinic? What more do you do? What are you waiting for maybe from the state? Do you need additional guidance from the state? Do you need something from your county? Do you need something from ITUP? What other types of information do you need to continue to move this forward? Jenna, I know you got to jump. Maybe I'll go to you for a last word before you got to leave.
I was just saying my goodbyes in the chat, but what we need is technical assistance, especially the CBOs. Steve, thank you for the last comment of constantly engaging with the plan, connecting with the plans. I will take that to heart, but we also need TA. We don't know. I'll be very vulnerable and say that we don't know what we're doing right now. Yep. So I've been on top of our county folks, sending them emails and calling, asking them for support. And for those of you who are further along, where, if you're able to provide some sort of mentorship, we'll be willing to take that as well. But we definitely need capacity building support and TA assistance.
Mm-hmm. Great. Thanks, Jennifer. And I know those PATH funds are coming. I know we're a little concerned that folks either don't know about them or won't have the capacity to even apply for them. So that's another, I think, thing that we wanted to check in on. But yeah. Thank you.
Yeah, and Emily or Katie, I will connect offline one-on-one. Thank you so much for this discussion. You are all incredible people. Have a wonderful day.
You are. Thanks. Take care. Good to see you. Bye.
Bye.
Anyone else want to jump in? Steve, I see you're unmuted. I don't know if that was on purpose.
No, I've already said enough this morning. I'm more interested in being educated and hearing how things are going.
Perfect. Joel, please go ahead.
So just to follow up on what Geneva is saying, I think, where we're at is, I think, in Sacramento County, I feel like we have sort of like a range of where providers are, from those who's already been involved, from pathways from the get-go, and then those who are new. And then we have individuals who are also involved in pathways, but, weren't necessarily involved in health homes and billing claims. That's huge. I mean, we had a lot of learning in health homes, and we just don't have the technical assistance. We know how to do the work, but it's very laborious work, right? So making sure that there is support. We know that I believe with the path, there are some potential TA that would happen there too. But I think, certainly infrastructure, right? As you all know, in Sacramento County, we have 5 plans, and they sort of have 5 different ways of doing it. So it's having to build up our team, from a, nonprofit. Like, how do you build enough team to even, first and foremost on the ground, building that capacity there to have enough staff to carry a caseload, and making sure that it can carry you as an organization as well, but then also have the administrative support as well, to not only from the claims, but the monthly reporting, the different reports that are asked of us to submit to the plans. I think our ask would be, is there a way that we, and I lead our data management, and we develop and we utilize our own in-house Salesforce system. It's what we also used and built out for a whole person care. At that point, we had a shared care plan, which, it is now dormant. We don't use. I'm certainly not suggesting that, but then that there's, from a technology sharing of information, being able to have some guidance around governance, right? Data governance. How do we share that data to, like creating hopefully some kind of system or technical assistance around EDI for batch claims. You'll probably hear a lot more of that, just because I lead the team now from that batch claiming. Right now, it's very manual. It's very labor intense. I know that per the contracts that we have, it is expected of us to enter all encounters. And so the caseload right now is one CHW to 50, at least, for our contracts. And so, as you can imagine, that's 50 individual times however many contacts, and then with the expectation to make sure that we pull all that. We want to do the right thing. We want to enter all that. But again, labor intensive, want to make sure that, the rates are even appropriate, and we're going to sustain ourselves. So anyway, I'll stop there, because then I could absolutely, just feel like I'm word vomiting about lots of stuff, but I think it gets down to technical assistance, especially around billing. I know that, some of our partners here in the county haven't quite started yet, because they yet to really understand how to bill. We just received some direction on how to bill for like community support. And I recognize that is very different. Right. I think someone mentioned that, that the line of, ECM is sort of straightforward, very similar to health homes. I think we got that down, and others are still learning. But CS, because of the different, services, the 14 services under it, like that's, to be billed differently as well. And so, again, just technical support around that, how, can we get guidance, or is there any way that we can simplify that? Because I feel like, it's so much work on the back end, and, it's been 6 months, and we finally have gotten to a place where we know how to start billing that. And so while we're in a different place, I just can't imagine for other providers in our county or elsewhere, like how are they carrying their caseload, and how are they able to, bill? Because this is not, it's not what a typical nonprofit will get a grant. We could eat half or paid up front. Now we're sort of pivoting, having to think about, how we do our business. So it's great. I feel I've been in this field for over 20 years. So it's been wonderful to see that, we can finally bill all these services that we always felt under Medi-Cal as a Medi-Cal service. But at the same time, there's just this huge learning gaps for providers to ensure that, not only could they do the work, but bill and get paid for work. So, all right.
Absolutely.
Thank you.
No, it's a wonderful opportunity, lots of challenges. Rob, please go ahead.
Yeah, I mainly just wanted to kind of echo the sentiment about the need for technical assistance, and appreciate to some extent, the counties can provide that. I also think, and I'm just, especially around the billing thing, right? I'm on the board of some community-based organizations. So now I understand like things that we take for granted, like having an NPI number, right? Especially smaller based community-based organizations, just it's a big hurdle for them. And so I'm noticing that we don't have our Placer-based community-based organizations as part of this. And so I know with whole person care, it was really helpful for the whole person care counties to get together, even though we had technical assistance from the state to share best practices and kind of troubleshoot things together. And I think something like that, maybe on a regional basis for community-based organizations to get together and share. And hey, maybe even having community-based organizations doing more crossing lines to fill gaps. I'm recognizing that in Placer, so we might have some gap. Community-based organizations who are comfortable providing some of the services under CalAIM, but maybe not all of those. And so maybe a little bit more cross-pollination, even on the services that are offered by those organizations across county lines, might really help to meet the needs of Medi-Cal beneficiaries.
Yeah, absolutely. Thanks, Rob. Really appreciate that. Anyone else want to jump in on this question? Anything else you need? Philip, go ahead.
I will. Yeah, I want to put a plug. Somebody mentioned a little bit about DMC, so I want to talk a little bit about substance use disorder treatment. And one of the Sutter Yuba is a state plan, one of the 20 state plan counties that are still out here. And so, for various reasons, we've chosen not to opt into the ODS, and we're in contract season. And so we've been working with CBHDA on our contracts with the state, as the state is, how do I say it? Moving us into the waiver, whether we opt in or not. And so there's quite a bit of discussion about that. And then some of the SPA changes that took effect, and then the, some of the state plan services are expanding. And so those have been really challenging for us. So I know that, under CalAIM, not only on the mental health side, but also, the SUD it's a big deal. And for a lot of the small counties, many of us have only been drug Medi-Cal certified for 2 years. So on top of, and I think who was talking about billing, I think she left, but on top of the billing issue, as far as being new, just billing DMC services. Now we're moving into CalAIM, and now we're moving into, sounds like we're going to have some reimbursement for dual diagnosed services. And so that really adds just another layer of, trying to figure these things out. So I just want to put a plug for SUD because I think it's important.
Absolutely. And can you just remind us what it means to be a state plan county?
Mm-hmm. So I don't know, several years, Rob might be able to speak better because I know Placer is an ODS county, but so the counties were given an opportunity to opt in as an organized delivery system. So basically the drug Medi-Cal system in those counties became managed care. And so the counties that were not able to make that lift remained under the old system, which is the state plan. So they're directly governed by the state plan. And so there's about 20 counties, and mostly they're all small counties, are in that boat. And so it's something that I keep putting up with CBHDA, is that don't forget about the 20 small counties out here that has a director that's basically the mental health director, the SUD director, the quality assurance officer, the billing supervisor, on and on, right? So there's quite a bit of consideration for us smaller counties.
Yeah, absolutely. That's putting just a couple pages and resources into the chat here for anyone who's interested in it. This is a whole different system, which is part of the issue, than your sort of typical physical health Medi-Cal managed care that we've been working on for the last few years. Drug Medi-Cal. DMC is drug Medi-Cal.
Correct. And then Katie, just, from DHCS's perspective, since they dissolved the Department of Alcohol and Drug, then they put the Department of Healthcare Services. So they brought the SUD services in with the mental health services. And, since that time, we've been really less supported on the SUD side. They haven't had the expertise, and it hasn't gotten much better. And as we move forward, DHCS is looking at kind of combining the mental health, the SUD, the physical health, right? This is all becoming something that they want to push together. And so for all the challenges that, that presents, it's been talked about for probably 5-7 years.
Yeah.
And, even just the SUD and mental health dual diagnose services. And that's been talked about the last 5 to 7 years, and it's still in the works, so to speak.
Yep.
And so, I think it's an important piece because many of our folks that we serve are dually diagnosed, not only with mental health concerns, but also substance use disorders. So it's not one or the other in many cases.
Yeah, no, I appreciate you highlighting this because this is all, even though we're talking about CalAIM, this is all going on in the background as well at the department. And I know counties are really working with this. I think it also, these are way back when we talked about integration, and integration is probably the wrong word to use now, but bringing these systems closer together, they are truly separate systems. And that's a big challenge. And even within the department, they're managed by different divisions. So the management is not the same. And so you sort of have the physical health, Medi-Cal managed care plan system, and then the behavioral health division, which really was, pieces of the Department of Mental Health and pieces of alcohol and drug programs put together. So thanks for reminding us. I think that
and to really be clear that, a lot of the CalAIM changes are being applied to SUD. It's not being talked about, but it is when you're in the SUD realm a lot, then you notice that, CalAIM is not just mental health. It is SUD, even though it gets less attention.
Yeah, absolutely. No, I think that that's really important. And the people are all the same, right? All of the beneficiaries and consumers that we're talking about who are eligible for community supports and ECM, many of them are also served by the county behavioral health system. So very important to keep that in mind. So not to take the conversation over this way, but it's just a reminder of how this all fits together as we're talking about these issues. All right, with the last few minutes, there's so much to do here, and it's just going to be a process. Is there anyone else in the community, particularly when we're talking about community supports, anyone who you think we should also be including in the conversation who's not? Are there other community-based organizations or types of community-based organizations that you as counties or health plans or even as sort of partner CBOs would like to see at the table, or anyone else that you think the state needs to know about who is not at the table in these conversations?
So Katie, one of our partners in Sutter Yuba that are really important are the CBOs that are providing emergency shelters, housing, working with the homeless populations. And so we meet monthly with a couple of our CBOs that are working with that population, in addition to our local law enforcement agencies to deal with the populations, the encampments, trying to work together to get ideas on how to move people towards treatment when they need it, and or away from homelessness into a housed situation. So those have been really important partners for us, and I'm glad to say that they've really shown up. They're at the table, they're working things out with us, and so that partnership has been really, really great.
That's a wonderful comment. Anyone else? Joyle.
So I can think of a couple of local community support providers, but I think this is one of the assets that we've had of certainly the plans is, understanding who is an ECM and CS provider. I think that would be helpful, just so that we can reach and connect with, other providers and, learn from each other as well. So I know that didn't quite answer your question, but that just reminded me that was certainly an ask from our lens. Yeah.
More like, and can I just make sure I clarify? So essentially asking the department or a health plan to say, who are you also contracting with as a community support provider or as an ECM provider, so that we know similar organizations and can learn from them. That's what you're looking for.
Correct. Or if we encounter individuals and working with individuals and can understand, who are they connected with, and be able to, refer them back over. And so being able to just be transparent about who are current ones in our county, I think would be helpful. And I think that will allow us to then understand who we're missing at the table.
Yeah. Interesting. Yeah, we also have had some questions from outside entities about the usefulness of some kind of a community supports and ECM provider directory. And this is probably the first useful, first useful case study of why that would be use case for that kind of a directory. Just knowing who, having a list of folks, not just the list of ECM and community supports that are being offered in, I guess, community supports that are being offered in a county, but who's actually on the list and providing those. So that's great. I think that's something that is not available today. We'll definitely lift up that ask and add it to our talking points. Anyone else? Janine, I saw you came back on video. Was that a desire to say something?
Thanks, Katie. Yeah, no, I think just building off of Joyle's comment there, I would echo. I think that would be helpful and would allow us also to see providers that may be serving our region, right? If we have providers that are working across counties there, there may be lessons learned and different opportunities to engage regionally or consider capacity regionally that currently we don't have line of sight to. So I do think that would be helpful. And also I know through the most recent process that is still underway around the IPP funds, right, that providers are able to express their needs for technical assistance and support to plans, and they'll consider that funding. But again, as we try to understand countywide and then even regionally where capacity exists and where the gaps are, I think the first step is knowing who the providers are. So I just want to echo, I think that would be helpful.
Thank you, Janine. Yeah, I really appreciate that. I also just added IPP's incentive payment program for CalAIM, and I just added a resource in there too, in case you want to pop that open to see what it is. Philip and then Jared.
So another comment, Katie, that as far as TA, I'm thinking, and this is going to kind of speak to the criminal justice population as well. But I know that we've been working, or I have been working on the CalAIM changes with the incarcerated population, where we get the 90 days post-release in order to get benefits established and really start to connect inmates to services. And I've noticed one of the deficiencies is trying to coordinate with social services, the people that are actually doing the enrollment and getting people enrolled. And that's been kind of a tough place. And I'm wondering how much involvement there is with, as far as that, expansion with being able to enroll incarcerated individuals, if there's been much outreach to to our social service partners and, the benefits people, because at least in Sutter Yuba, I've noticed that, it's been a little bit tough, a little bit harder of a push, but I think it's going to be a really important piece as far as benefits for this population. So I just want to comment at that.
Yeah, thank you. And that's a whole other population that we haven't really talked about. We did do a panel on this, on the reentry population at our conference, and we just added a resource here, but CalAIM is that gift that keeps on giving. There's a lot in there. Jared, I know you'd unmuted for a second. Did you want to add something too?
Yeah, I was going to chime in, and please forgive my ignorance because this is my first meeting I've attended, but I don't know if anyone from our special programs team at Anthem has joined, but maybe I can include them in future meetings. That way they can discuss those providers who are enrolled for ECM and CS.
Yeah, thank you. That would be great. And even potentially connecting offline, that would be great. Thank you.
Yeah, absolutely. Thank you.
Great. All right. Any last comments from anyone who wants to add more about who should be included or at the table on CalAIM? Okay. All right. I think we're good. I think we had one more question about is procurement and waiting for those contract rewrites. I know we got a few health plans on the line, and we know you don't have to say anything on this, but just wanted for everybody else, just wanted to see if procurement was impacting you as well. I don't want it to be a big topic of discussion, but wanted to throw it out there. So everyone know what I'm talking about procurement. We're reprocuring the Medi-Cal managed care plans, all of the commercial Medi-Cal managed care plans in your county. And those go live January 1, 2024, and DHCS is in the process of evaluating all of the applications from all of the health plans. Anyone have any comments, or are we all just playing the waiting game? Rob?
Yeah, I'll make a comment, knowing that we have actually some of our plans on the line to say thank you. Because I think the concern was, that we would kind of lose a partner because of the procurement process. But California Health and Wellness and Anthem have continued to be really good partners, not just with the county, but as I mentioned, with our community-based organizations. So wanted to say thank you for that. I know it's a big change, kind of a challenging process, but appreciate kind of the focus on it's such an exciting time, so important for our beneficiaries, and kind of the continued partnership is much appreciated.
Thanks, Rob. Philip, I saw you mouthed waiting game. Anything else to say on that?
No, I was just saying I agree with Rob that they've been important partners, so we appreciate that.
Perfect. All right. So with that, we have one last final wrap-up CalAIM poll. And then we'll let you all go. Really, really appreciate you all participating today. This has been a wonderful opportunity to talk with you all, and I really appreciate the breadth and depth of experience and different roles we have on this call today. Hope it was helpful for you all. Definitely don't hesitate to reach out to us if you need anything. Sit on budget, legislation. We're doing some training. So if you have folks who need some training on budget and legislation and administrative processes at the state level, we have some new resources there that we'll drop into the chat. Of course, we have some CalAIM fact sheets and are just generally here if you need us. And again, if you're interested in broadband, let us know. We'll be reaching out to a couple of you as well who expressed interest in that. So thank you all. We'll leave the poll up for a couple more minutes, but really appreciate your time today. And hopefully we'll see you all soon.
Thank you, everyone.
Thank you.
Thank you. All right. Take care, everybody.
Thank you.
Thank you. Bye. Okay. Ending the call. Bye.